Hey there everybody, it's Brian. Welcome back to Med Ed Insights. Today we're going to be talking about 5 things that you can do to make the most of your away rotation this upcoming 4th year. If you're a rising 4th year medical student, it's probably time to start thinking about getting ready for those away rotations. Maybe you're just looking to go to get some more exposure to the field, or maybe you're planning to rotate at the residency of your dreams that you hope to match at the coming spring. In today's video, I want to talk about 5 different tips that you should keep in mind as you prepare for your away rotation to help make it the most successful it can be. These rotations can be really important, especially if you're going to a program that you hope to match at in the coming months. It can really make or break your chances at that program based on how you perform during your away rotation. So a lot of people understand for sure that the residency program are going to be evaluating you while you're there doing your away rotation. But what a lot of people forget is that you should also be evaluating the residency program. Whenever you go interview somewhere during 4th year, you're only going to have maybe a dinner the night before and then a half day or a full day to really try to get a sense of what the program is like and what the people there are like as well. But if you go rotate somewhere for a number of weeks, if not a full month, you're going to get a more complete picture of what that program is like in terms of the people working there, how everybody gets along, the workload, those sorts of things. And so just as much as the program is evaluating you, you should be evaluating the program to see if it's a right fit for your personality and your career goals. Obviously, it's a really important number of weeks because if you do really well, it can set yourself up for success down the road. But if you don't perform very well and you don't get along with people, then you're probably not going to match at that program. So let's talk about 5 different things that I think can help you to really succeed on this away rotation and make the most of it. The first thing is be prepared. Now, this probably sounds obvious and a lot of people know that they need to prepare for the rotation, but I'm talking about more from a medical knowledge standpoint. Make sure that you're up to date and just comfortable with the basics of whatever specialty you're going into. So if you're going into general surgery, make sure you know the basics of managing a surgical patient on the floor, or you're comfortable with your knot tying skills. In my case, going into PM&R, when I did my away rotation, I wanted to make sure that I felt comfortable with my joint exams. Certainly, they're not going to be judging you based on your extensive medical knowledge, comparing you to the residents, but it's important when you do this away rotation that you're comfortable with sort of the basics of the specialty you're going into so that you can fit in and sort of partake and participate in what's going on. So find the things that are most important, make sure you feel comfortable with them, but don't go off and try to become an expert in the field. Probably if you try to do that, you're just going to look like an overachiever and that's going to come off the wrong way. So just know the basics, just be prepared for kind of the routine things. The second thing is be yourself. A lot of people will go somewhere and they think that they need to fit in with the residents that are there by doing something rather than seeing if they fit in just based on their innate personality. So people will change who they are to try to match up with the residents and the consultants. What's more important is that you just be yourself. And that's not as much so that you can do well or do poorly, but it's so everybody can get a good sense of who you really are and if you fit in with that program. You might have all the medical knowledge in the world, but if your personality doesn't really align with the rest of the residents and the staff, you're going to butt heads for 4 years and it's not going to be a good experience. So make sure that you're being yourself and that you're not trying to change who you are just to fit in. Because while that might seem like it'll work in the short term, it's only going to hurt you down the road whenever you can't keep up that changed personality and then you find out that you don't get along with people and it's a miserable time. The third thing is be on time. And this is probably one of the biggest things being an intern this year that I've noticed whenever I'm looking at sort of evaluating medical students. It's not so much your medical knowledge, but it's the things like, are you prompt? Are you on time? Can I trust that you're going to get the work done and that you're going to be on time when you do it? And it's really easy to do. Just make sure you're on time in the mornings, if not a little bit early. Make sure that you're on time to lectures and rounds and things throughout the day. And then make sure you're staying an appropriate amount of time in the afternoon and not trying to leave early to go enjoy the city that you're in. Doing these little things that aren't related to your medical knowledge really show the residents and the program director that they can trust you to be an efficient and effective resident when it comes to just getting the work done. The fourth thing is be respectful. And I'm not just talking about towards the residents and the faculty that you work with, but more importantly, be respectful towards all of the non-doctors that you meet. And that's important for a couple of reasons. First of all, you should just be treating everybody with respect, regardless of if you're interviewing for a job or just going about your day-to-day business. But number 2, you never know who those other people might be and what their impact might be on the training program. So for example, if you're rude to someone in the cafeteria or you close the door in someone's face, you don't know, that might be one of the clinical assistants who works in the program that you're interviewing for, or that could be a nurse who's married to one of the consultants that you're in the program for. So instead of taking that chance of really hurting yourself, just treat everybody with respect. Be just a nice person and helpful to everybody that you meet, because not only is it the right thing to do, but it can also make an impact if those people are connected to the program down the road when people are trying to gather feedback about what your experience was like. And the last thing is make connections. And this is important not only if you do well and match at the program, but let's say you don't end up at that program, regardless of if it's because you don't fit in or because you don't match there, but those people are still going to be your colleagues. And so it's going to be important down the road when you're interviewing for things like fellowships or you're at conferences, when you will undoubtedly interact with those people again later on. So make the connections for that aspect, but also make connections with the residents while you're there during that month. Don't be forgettable to where later on when you come back to interview, the residents are all scratching their heads trying to figure out who you are. Don't, try to do something crazy to stand out, but just hang out with the residents. Go have lunch with them. If they invite you to do something on the weekends, go hang out with them. Make sure you just get to know people so that later on they remember who you actually were. Also try to get a sit-down meeting with the program director just to make sure that you've formally met each other, to express your interest, ask any other questions you have, and then see if there's anything else you can do to increase your chances of matching there later on. So that's it, everybody. Just those 5 things that I think can really make your away rotation a much better experience and really set you up for success. Again, this shouldn't be an overly stressful time. A lot of people go into it intimidated because they think that the program is judging them at every turn, but really being on the other side of it this year as a resident, we're not really judging you on your medical knowledge and how many research papers you've written. We're judging you on just how well we get along with you. People want to work with someone that they enjoy being around, and the medical stuff will come. You'll get the experience, you'll get the training to be up to date, but more so just be yourself, because we just want to see what type of person you are and if you're someone that we would enjoy working with during residency. And that's really what matters the most. So don't be stressed about how much you know or how good your knot tying skills are or anything like that. Go into it with a positive attitude, be yourself, and try to have some fun along the way. That's it for this video, everybody. Don't forget to subscribe down below if you enjoy watching these videos. Give me a thumbs up with the like button as well if you enjoyed it. Let me know if you're getting ready for your away rotations or if you have any additional questions or thoughts about how you can prepare for these upcoming months. Thanks for checking out the video, and we'll see you next time. Bye.